Good afternoon, everyone. I hope you all had a great lunch and some stimulating conversations at the lunch tables, and we're really excited to get the afternoon started here. And it is my distinct pleasure to introduce Lara Stemple. She is the Director of Graduate Studies at UCLA School of Law, where she directs the Health and Human Rights Law Project. Professor Stemple teaches and writes in the areas of human rights, global health, gender, sexuality, HIV/AIDS, and incarceration. Professor Stemple currently serves on the advisory board of UCLA's Center for the Study of Women, and she is the deputy co-director of the UC Global Health Institute's Center of Expertise on Women's Health and Empowerment. Before joining UCLA, Professor Stemple was the executive director of the human rights organization Just Detention International. Professor Stemple has drafted legislation that was signed into law, lobbied members of Congress and United Nations delegates, and testified before legislative bodies. So please join me in welcoming Professor Stemple. Thanks so much.
Good afternoon, everybody. Hi. So I had a great lunch over here with students and staff members from across Southern California. So it was just stimulating and wonderful, and I'm really excited to be here. I think it's high time that we all in our large metropolis got together, those of us who are interested in global health. And I'm especially excited about the interdisciplinary perspectives that a lot of us are curious about and are bringing to the table. So I was noticing, oh, thank you. I might move it because it looks like it's going to fall. Oh yeah, someone told me to say I'm okay with pictures being taken. You can tweet away all about me. I'd love it. So look, there's this scale. This is very law-ish. I see Capitol building. I'm feeling very included. So we joke at UCLA about North Campus and South Campus. South Campus is where all of our health sciences buildings are located, for those of you who don't know, and North Campus is where the social sciences are, the humanities, the law school, the business school. So I sometimes tease my South Campus colleagues that I'm the token North Campus guest at these types of events, but seeing the symbols on the poster make me feel like it's more than tokenism. So I'm really happy to be here, and I'm happy to talk to all of you about health, human rights, and gender. I'm going to put my little timer on. So I'm going to talk for about 35 minutes, and then we're going to open it up for Q&A, and I really welcome you all to participate. I'd love to just have a dialogue with you. Let me start by asking how many of you, by show of hands, are either lawyers or law students? Please raise your hand. One in the back. One. Hello, fellow lawyer back there. Okay, raise your hand if you've ever taken a class on human rights. Okay, that is excellent and very inspiring. So I'm so happy to see that even though you are not law students per se, you are still studying and learning about human rights. So, and that seems like about a third of the people in the room. So that's exciting, and it makes me feel good about the talk because in certain ways I'm going to go deep into some of the legal issues and the ways that we think about health and human rights together. So delighted to have you do that with me. So starting out by asking, what do we mean when we say human rights, right? So this is a term we're all familiar with, but it can be kind of confusing because we use it in different ways. So it can be a field of study and practice. So I might describe myself as a human rights lawyer, or someone might describe themselves as a human rights activist, and by that we mean that's what they do, that's their area. It also gets used colloquially. So if I said the phrase to you, love is a human right, you would understand what I meant by that, even though as a technical matter, there is no human right to be loved, as sad as that is. And that's because, actually, there is a set of laws that are written down in black and white that spell out exactly what international human rights are when we use that meaning of the term human rights, when we mean it in a legalistic way. You can read human rights treaties and you can see what the collective body of international human rights laws are. So it also gets used to mean this general principle that all people are created equal in human dignity, that kind of nugget, that fundamental essence of our humanity that entitles us to a basic set of human rights. So I just want to underscore that it is very much more than this notion, more than this more than this moral obligation, this notion, this colloquial understanding, but in fact, a legal obligation. And I know there are a lot of health scientists in the room, so I think it's very important to distinguish the body of human rights law from medical ethics. Okay, so medical ethics or any other set of ethics that are created by professional bodies where they agree together about the standards that will guide their profession, human rights law is decided upon by states through the United Nations largely, but not exclusively. So when we think about health on the one hand and we think about human rights on the other, it's nice to think about health and human rights together, but the reality is they're different, right? They're different disciplines, they have different histories that have brought about different terminologies, different ways of practicing, they have different philosophies. The commonality, of course, is they're both fundamentally concerned with human well-being. Right? So they're the good guys. We're the good guys, right? We want to make the world a better place. We have different ways of going about it. So sometimes there are tensions. So quarantining is the classic example. You could imagine a quarantine that absolutely improved global health. You put people apart from everyone else to prevent the spread of disease. That has human rights implications in terms of the liberty interests of those people who have been quarantined. So there's a tension there, and sometimes the disciplines are at cross purposes, but that's increasingly less so. And today, these two fields are really seen as mutually reinforcing. Human rights improves health. Good health helps one realize their human rights. Some other ways to think about human rights, these are sort of the simple ways, and then my next slide is going to make it a lot more complex, so that it'll be more interesting to those of you who have studied human rights before. We'll look at some of the real tensions within the discipline. So in general, human rights are based on human dignity. As I've said, they're universal, meaning they apply to everyone, regardless of where you are in the world. They are meant to transcend borders. For the most part, human rights adhere to the individual. Now, there is some evolution around the concept of group rights, indigenous peoples' rights, and so on, but by and large, human rights adhere to the individual, and they are largely the responsibility of states. Again, this is a simplification, but for the most part, it's states getting together and deciding which rights will be set forth in human rights law. Of course, there's other work about businesses, for example, respecting individuals' human rights, and that's an evolving area of the law. So here are some more complicated ways of thinking about human rights. I like this trio of describing, I got this from Carol Vance at Columbia, human rights as idealistic, aspirational, and hypocritical, right? Sometimes those of us who are advocating for rights on the one hand are trampling on rights in another way without intention. It's a complex set of norms and principles, and they aren't always in sync. It's not a perfect movement, it's a human movement. The next set of bullet points reflect some of the current tensions and the real philosophical debates that happen within the area of human rights. So are human rights universal? On the one hand, they apply to everyone regardless, or are they culturally specific, depending on where you live in the world, depending on what the cultural norms are in your part of the world, might your rights in fact be different? A big debate, sometimes called cultural relativism. Are human rights ahistorical, or are they constantly evolving? Are human rights something that have existed from the beginning of time? Or, in fact, are they something that are politically contested, evolving, changing, adapting as the times change? Are human rights based on morality, based on these fundamental principles of right and wrong? Or, at the end of the day, are they really based on who has power, who's in the room, who has the ability to write the laws and to implement the laws and enforce them? Are human rights globally transformative, meaning we have really changed things since we started to develop international human rights as a body of law? Has this been a radically transformative movement that has changed the world? Or are these a set of norms that are just aspirational, but at the end of the day, pretty weak, pretty under-enforced, human rights violations being rampant in many corners of the globe? All important questions. I also really like the phrase, I like this way of thinking about what we mean when we say human rights. A site of struggle in engagement with a state. I think it speaks for itself, but it's a different way of thinking about it. It's about the activity, about what's happening, who and how. Another important thing to realize, and this I teach law students, and they really struggle with this because they want the black letter law, they want the answers, they want to know what the law is. But when you're talking about the international stage, when you're talking about the United Nations, it is a forum for states to get together to do work themselves. The United Nations is not a world governing body in the sense that it has any power at all to make states do what the UN wants them to do. Rather, states are sovereign. They come together at the United Nations to work it out themselves. And it's a political process. It involves power and trade-offs. So anytime a state is agreeing to sign a human rights treaty, that state is agreeing to tie its own hands and say, we will not treat our citizens in the following ways. Even though we are sovereign, we are promising to change our behavior. And so a big question for those of us who look at states and their behavior, why would a state do that? Why would a state chip away at its own sovereignty, its own ability to act however it wants, when nobody's telling it has to, right? So it's a puzzle, it's a question. Nevertheless, states do it. So they are chipping away at their own sovereignty, and a lot of that is because they are engaged in a worldwide political process that has increasingly emphasized human rights over the last many decades. Okay, so that's a little bit about rights. Let's look at health. This is a definition many of you may have seen from the World Health Organization. Health is defined as a complete state of physical, mental, and social well-being, not merely the absence of disease or infirmary. And I think this definition is incredibly powerful because it is so broad. Some might even argue that it's too broad. Social well-being? Wow, a complete state of social well-being? How many of us have that at this very moment? I mean, it's like the right to friends or something, the right to good friends. But I think its breadth is meant to signal something. It's meant to take us out of the clinic. It's meant to talk about the fact that it's not just a disease-oriented response, but rather one that's about enhancing the whole person in terms of their health. Now, when we think about human rights law, it's good to situate it in terms of other areas of international law that you may or may not be familiar with. Human rights law being the body of law that I'm talking about today, but there's also humanitarian law, which is the law of wars, and international criminal law. And you can kind of think of these as three circles in a diagram where they're overlapping, but yet have many distinct characteristics of their own. And in that circle of human rights law, there are the following foundational human rights instruments. So the UDHR, Universal Declaration of Human Rights, if you've only ever heard of one human rights instrument, this is the one that you've heard of. So it was promulgated in 1948, coming out of World War II. It is the most revered, the most talked about, the most lauded of our instruments. And following that, it's somewhat general. And two more specific instruments followed in the 1970s, and those are the International Covenant on Civil and Political Rights and the International Covenant on Economic, Social, and Cultural Rights, known as the ICCPR and the ICESCR for short, even though it's still long with the acronym. And here's a little bit more about those two different treaties, okay? So it's useful to look at them side by side, and it helps us think about these various conceptualizations of rights. So positive rights on the one hand, negative rights on the other. What do we mean by that? So positive rights, the government must provide, it must do something. So again, this is the International Covenant on Economic, Social, and Cultural Rights. This is where the right to health is located and articulated. So the government has to do things to provide education, clean water, healthcare, and so on. Negative rights, in contrast, the International Covenant on Civil and Political Rights, these are most similar to the US Bill of Rights. So they're much more about government restraint. The government ought not to do certain things to interfere with one's liberty, right? So you can think of the right to organize, to be free from torture, to be free from any harm that the government might do to you. So that's why we think of them as negative rights. And as I say, these were both developed in the 70s. So you can imagine if you map kind of geopolitical histories onto these two treaties, you've got the Soviet sphere of influence, of course, with the positive rights and the government duty to do things, and the American sphere of influence on the other. And if you look at the countries that signed and ratified those treaties in the 1970s, it mapped perfectly on to the Cold War spheres of influence. Now today, most states have signed both treaties. The US has still not signed or ratified the ICESCR, but we have moved on. Besides that, we have mostly moved on from the Cold War politics, and most states are parties to both. So those are Fundamental building blocks, it's important to know about them, but it's also important to complexify them because they are foundational yet somewhat of an oversimplification. Because of course many rights require both positive and negative actions on the part of states in order to be fully realized. So for example, the right to vote, that's a negative right in the sense that the government ought not to interfere with one's right to exercise one's right to vote. On the other hand, it requires the government to do a lot of things in terms of providing polling places and conducting fair and transparent tracking of ballots and so on. The right to contraception, we're going to talk more about women's health. All fine and dandy to say that the government's not going to create laws against using contraception, but if a woman or a man has no ability to buy contraception or no ability to figure out how to use it, no access, then that right is virtually meaningless. So the more contemporary construction of rights and the realization of rights uses this trio: respect, protect, and fulfill. So you see that in a lot of the more contemporary human rights instruments, and that's meant to get at this robust way of thinking about states and their duties. So respect, again, is the negative rights. Another example, no coercive sterilization. That's a government harm. The government ought not to create that harm. Protect, this is the new one, okay? And this is where women's rights had a massive victory in the international arena in terms of getting over what's called the state actor hurdle. The state actor hurdle means it's not just about the states and what they do or don't do to individuals, but it's about the state responsibility to be involved in third-party harms. Okay, so that was new. That did not exist for decades. It was not until the 1990s, really, that international women's human rights activists got together and said, we care about these third-party harms. Women are not being tortured necessarily by the state, but they are experiencing sexual victimization at the hands of people they know. And when a state does nothing about it, that's a state inaction, a state failure to protect from third-party harms. So this term protect is a new one. The concept is a new one and is now virtually unquestioned in terms of the ways in which we think about human rights law. And then fulfill, again, is the positive right, so the government providing tools necessary or access for people to realize their right to health. So good for you to know about 4 population-specific conventions. So these came after the two, the ICCPR and the ICESCR. One CERD on racial discrimination, CEDAW is known shorthand for the Convention on the Elimination of All Forms of Discrimination Against Women. There's a Children's Rights Convention, and the most recent is the Rights of Persons with Disabilities. So these are population-specific and get a little bit more into the detail about rights for those groups. And I have a slide just on CEDAW, and I'll talk about that in a minute. But I first want to tell you how these treaties, conventions, they're basically synonymous words. So when you hear those, you can just assume they're synonymous. There's a slight detail, but it's not important. So conventions work by requiring states to report before treaty monitoring bodies. So there's a body, there's a group of people that gets together and says, okay, states, you've ratified this treaty. Now every period of years, and this is set forth in the treaty, you must come before us and tell us what you're doing in order to implement human rights. The states come before the treaty monitoring bodies. The treaty monitoring bodies listen. They issue their own comments back to the states saying, we think you did very well in this area. You need to improve, however, in this other area. And for the most part, that is it. Okay, so that's how a treaty gets enforced. Sounds pretty weak, right? It's just a dialogue between the treaty monitoring body and the state. And that is where human rights law gets its reputation for being a weak area of international law as compared to something like international trade, international environmental law, where there are real sanctions and more teeth when states don't comply. Human rights law in that regard is very weak. There are also general comments that are issued by the treaty monitoring bodies to give more detail to the treaties, which tend to be a bit minimalistic. So in terms of the right to health, we saw in the early 2000s, there's just about 20 words that are in that ICESCR on the right to health, and I'll show you those. But in the 2000s, the treaty monitoring body said, okay, now we're going to issue a general comment that expounds upon the right to health. It's like 20, 24 pages, a lot of detail about what the right to health really means. And as you might imagine, this sometimes gets contested by states. So they say, look, we signed the treaty. We knew what that said. We didn't know that later you were going to develop these 24 other pages about what we're supposed to do. That shouldn't be binding upon us. Of course, the counter-argument is that, well, in the treaty itself, it says that we're going to create these general comments, and you sign the treaty, and this treaty monitoring body is a fair body, and we rotate members and so on. So it's a contested area of the law. And then finally, there are these optional protocols, which are somewhat underutilized and rare. States don't always sign them, but these protocols create a judicial mechanism for the treaty. So that's where the teeth kind of can come in. So they're optional. So a state that, for example, has signed and ratified CEDAW can also agree to be bound to this judicial protocol whereby people can bring, people and groups and states can bring cases before it. So this all points to this kind of spectrum of bindingness, if you will. So soft law on the one hand, hard law on the other, binding versus non-binding, and it's all a bit complicated. But it is important because, again, this is about politics, so you have to know, when does it really matter for states? How bound are they? How hard is this law? Versus, well, it's just kind of suggestive on the other hand. And the conventions, the treaties, are the most binding of all because the state doesn't have to sign the treaty, but once it does, it's meant to be committed to that treaty. And those are some of the ways in which they're enforced that I've touched upon already. Important to know about progressive realization. This is the concept in the International Covenant on Economic, Social, and Cultural Rights, which houses the right to health. And what that means, progressive realization means, is that states are not automatically bound to comply the moment they sign and ratify. There's an acknowledgement of resource constraints, that all states are not equal in terms of their ability to provide these rights, so it's meant to be kind of a gentle ramping up of their realization of this right. States sometimes use that to get out of their obligations later, and there is some UN language about the fact that these progressive realization measures are not meant to get states completely off the hook, and they shouldn't be used in that sense, but instead to acknowledge that states are different and to accommodate that somewhat. The UN declarations themselves, if you think about what it is, it's usually created at the General Assembly level, and it's states declaring something. It's not a treaty. There's not necessarily any binding nature to it. It's the UN agreeing, the UN declaring its beliefs about something. So it's important in terms of creating norms, in terms of creating the ways we think about human rights. But there's virtually no enforcement. One exception is the Universal Declaration of Human Rights, and that, again, is so famous and so well regarded that it is seen to have risen to the level of a more binding legal instrument through a process known as customary law, which just means that when something becomes part of our legal custom, it is seen as binding. The international consensus documents are the least binding of all, and this is where some of the most important language on women's health and women's rights has been developed. I'll talk about a couple of those consensus documents in a moment, but just know that they're important for showing global consensus, but they are not binding on states. So CEDAW, again, coming out of the 70s, you can see it came into action, it came into force in 81 once 20 states had ratified it. It does have an optional protocol, so it has that judicial mechanism that I spoke about, and people can bring claims before it. They have issued general recommendations, these longer instruments that are designed to spell out what is meant by the more minimalistic terms in the treaty. They have one on violence against women, one on FGM, one on HIV, domestic labor, early marriage, and women's health, and so on. Here's a list of some of the states with which the U.S. is keeping company on its failure to ratify CEDAW, and something that still has not happened these many decades later. And it's quite infamous, CEDAW is, for its number of reservations. And what reservations are kind of tag-ons that states can put when they sign and ratify a treaty, saying, like, we're going to sign this treaty, but we don't mean it in this way. We're not going to undo this part of our law. We're going to reserve the right to violate the treaty in the following ways. And as you might imagine, this is another contested area of international human rights law. Okay, so I see that I have about 15 minutes left, so I'm going to pick up the pace a little bit. This is from the Constitution of the World Health Organization. So WHO formed right around the time that the United Nations itself was being formed, and even in its constitution, so this is, I think, from 1948, they described the enjoyment of the highest attainable standard of health as one of the fundamental rights of every human being. One of the most fundamental human rights of every human being in 1948, so that is a long time ago, where there was this very clear assertion on the part of world governments that indeed there is a right to health. It sometimes seems like it's recent because so much of the activity to really enforce this has come about in more recent decades, but it is something that was envisioned from the very beginning of WHO. Okay, so what are states doing? In what way are they recognizing a right to health? Here's a chart that shows you the number of states across the bottom. So 63 states recognize the right to health in their constitution. The U.S., of course, is not one of these states, but you can see that 63 states do have the right to health in their constitution. 161 states have ratified the International Covenant on Economic, Social, and Cultural Rights, and then 194, which is virtually all member states of the United Nations, have ratified at least one treaty that in some way recognizes the right to health. So we've talked a lot about health and a little about health, a lot about human rights law, but what do we mean when we talk about health and human rights, and how are they interrelated? And I'd like to posit that they're actually interrelated in 3 distinct ways. Okay, so these are all different ways in which they're interrelated, and it's important conceptually. So human rights abuses themselves can, of course, harm one's health. So if someone is abused or tortured in some way at the hands of the state, that has negative health outcomes for people. Secondly, health policies and programs themselves, so the ways in which health systems operate, can violate human rights or enhance human rights. So when a health system has a policy whereby women are required to get the consent of their husband in order to have a medical procedure done, this violates women's human rights. Health itself can be improved by a full range of human rights, the right to education being a good one. We don't necessarily think of we think of the right to education as being more of a freestanding, different area, not a health area, but of course, as we all know, the right to health, when fully realized, when people are educated, when they can read, when they are empowered to understand how to take care of themselves and to read the instructions on their medications and so forth. This education, this right to education, is something that itself improves health outcomes by looking at these other upstream determinants. This is the part I think I'll zip through because it's the history, and I want to make sure we have time for Q&A. So let me just say briefly that before World War II, there was really no sense that health was the business of anyone besides the states dealing with people within their own borders. So there were some treaties that required notification about disease outbreaks, but it was really beyond the concept of international law, the idea that one state would even think to require another state to behave differently vis-a-vis its own citizens and their right to health. And this changed a lot in the wake of World War II and all of the horrors that we saw in that conflict and the states' desire to kind of come together and change things. And that's when you've seen some of this language in earlier slides, but the UN itself, WHO with their Constitution, and then, as I mentioned, the Universal Declaration of Human Rights, all acknowledged the right to health and made it really the province of other states. So the 70s, I talked about the International Covenant on Civil and Political Rights and the ICESCR, and this is where I just want you to see what specifically is in that treaty about health. So it addresses infant mortality, medical services, some language on the right to the highest attainable standard of physical and mental health, including mental health in the 70s, quite surprising and progressive, and more about diseases. Alma Ata was another international conference that really linked health and socioeconomic outcomes and was groundbreaking in that respect. Okay, so the 90s, this is important to focus on because 2 things were happening simultaneously, really in a way 3 things. But to start with the international women's human rights movement, it was a groundbreaking decade because there were feminists from all over the world who were for the first time coming to the United Nations and demanding their rights as women. That just hadn't happened before. There was even sort of a question of, are women's rights human rights? If you think about the right to contraception or the right to be free from violence, these had this kind of state actor hurdle problem, and human rights were really seen as almost something that happened to men. So you had groups like Amnesty International and their famous campaigns of the political prisoner who was held behind bars for his dissident beliefs, and that was sort of the face of human rights. And that changed in the 90s by women showing up and saying, look, we demand our rights, we want the UN to be responsive to them. And it's related to health because what women's rights did is they really grabbed onto some issues that were very clearly health-related. Violence against women being one, sexual violence, reproductive rights. Those were some of the issues that were at the fore of the women's rights movement then, and they demanded that the UN pay attention. And they held these conferences, one in Cairo called International Conference on Population and Development, and another in Beijing, and really shifted the focus. It was quite a successful political movement in that regard. At the same time, HIV was becoming a worldwide pandemic, and for the first time, the United Nations created an agency dedicated to only one disease. And of course, that was UNAIDS. UNAIDS, from the beginning, thanks to the work of a lot of health and human rights activists, framed the disease response as one that needed to be respectful of human rights. Because we know the upstream determinants are critical in that disease. We know that those who are most at risk are stigmatized populations who are often lacking in fundamental human rights. So those things happen, and then health and human rights was really born as a discipline. Academic institutions started to pay attention, teach classes, create journals. Many of you are here from USC. Sophia Gruskin was at Harvard at the time, and she was one of the early pioneers in this field, and we're very excited that she's now in California. But she and many of her colleagues, including Jonathan Mann and others, were at Harvard, and they really led the way in terms of forging this as a discipline. I've talked a little bit about the way in which health issues were central to this women's human rights movement, again, overcoming the state actor hurdle. And let me just I'm going to pause on this slide because I'd like to give one example that I think gets back to the first slide in a way in which I think usefully complexifies the different conceptualizations of human rights. So on the one hand, we talked about it as this nugget of one's humanity, and on the other hand, we talked about it as a matter of state responsibility. So what women's rights groups said is, look, if a woman is experiencing domestic violence, even if it's at the hands of a person who is not related to the state, it's a non-state actor, we think that that's a human rights violation of international concern. We think that the UN should take action. So that leaves us with a puzzle. So let's say a state is active on this issue. They have a well-trained police force that is incredibly responsive. They become involved in domestic violence disputes. They prosecute perpetrators. They provide support to women. There are shelters and so on. Just imagine the most ideally robust set of public health and policy responses that you can. So the state has done that. The state has fulfilled its human rights obligation in that regard. And yet, because these are private individuals, you can imagine that even within that state, there is a woman or a man who experiences violence at the hands of their partner, even brutal violence within that state structure. Has that woman's human rights been violated? Is there a human rights violation that has taken place in this context of a dream state? So it's important to realize that on the one hand, yes, and on the other hand, no. So on the one hand, yes, her human rights have been violated in the sense that we understand that it was a fundamental violation of her human dignity. It's that more colloquial meaning of human rights. Were her human rights violated at the hands of the state? Did the state live up to its human rights obligation? Yes, it did. It did everything possible. Humans are still imperfect and sometimes violent. So do you see what I mean? So that kind of gets at these different meanings and the ways in which there's sometimes tension around it, and we have to be careful about using that term human rights and understand the context in which we mean it. Lots has happened in the 2000s. I talked about the general comment on the right to health and Millennium Development Goals, now the SDGs. We've got UN declarations on HIV, many of them. Created a new special rapporteur, someone completely focused on the highest attainable standard on the right to health, a global fund, multilateral funding institution, and does fund a lot of projects related to human rights and the prevention of AIDS, tuberculosis, and malaria. The Framework Convention on Tobacco Control, groundbreaking, first ever treaty coming out of, who knew WHO could create a treaty? They did. States signed it. It's amazing. International health regulations are about disease notification, and the Convention on Rights of Persons with Disabilities is the newest treaty and a very important one. So NGOs, important to know that NGOs have been critical all along the way. I mean, we didn't even have NGOs, 100 years ago. This is a new phenomenon, just like self-appointed monitors of the public good. It's amazing. There are 40,000 international NGOs by one estimate. That's international. That's not even counting the local ones, and there are many hundreds of thousands more. They lobby at the UN level, at the national level. They can bring cases under some of those optional protocols, and they submit what are called shadow reports. So these treaty monitoring bodies, they only meet 2 or 3 weeks a year. A lot of the people who serve on them, it's just a diplomatic appointment, kind of a goodie, and they're not even expert on the issue. So lo and behold, non-governmental organizations submit shadow reports to these bodies saying, you're going to hear one thing from the state government about their human rights record, but we as an NGO are here to tell you that the situation is much worse on the ground. We're going to footnote it, document it, it's a professional publication, and those treaty monitoring bodies have no funding at all for investigation, no funding for research. They simply rely on what's coming from the NGOs, especially if it's an NGO with a great reputation. So you have groups that are doing advocacy on the one hand, like Human Rights Watch, where they're monitoring and creating reports, and then you have service providers on the other hand, like MSF, who are entering places of humanitarian emergency and providing services. But all of that range of NGOs are active and have influenced politics on the global stage in ways that are very hard to understate. And naming and shaming, of course, is the term that's used to describe the methods, especially of the human rights organizations who are there to monitor. So point out that the states have overstepped and bring attention to it. So about 3 minutes and just a couple more slides. I'm going to skip this slide and just talk about, so I think I've given you the kind of basics of where we are in terms of women's health and human rights, but I'd like to take you to the very cutting edge of where some of us who are working on women's issues and working on gender are right now. And that's to kind of expand the way in which we think about gender and include men and boys in our gender analyses. So throughout history, international law has used these kind of outdated gender narratives, these very kind of stereotypical ways of thinking about women as their rights, women and their rights. So women are often portrayed as victims, as kind of damsels in distress, and you can see this image on the cover of the Geneva Conventions. There's a tremendous confusion if you read the laws as I've done law review articles counting and analyzing the ways in which these terms are used in treaties, and governments all the time mistake things like gender-based violence for violence against women. They think that they mean the same thing when they don't. Because male sexual victimization is also very real. It's rampant in cases of armed conflict, and there's good data to support that, yet it is ignored at the international level. So there's still a gender analysis to be had. Men who are victimized are often feminized. They feel like their manhood has been violated. And of course, the perpetrators are exerting a form of kind of heteronormative control over their victims. And there's a way in which the women's rights movement is kind of poised to expand, I believe, and to use gender in broader ways to look at some of these cutting edge issues. And here's a JAMA report that came out a few years ago that showed that the prevalence of conflict-related sexual violence in the DRC, one of the most violent places in the world, is really not that different between women and men. Yes, women are more likely to have experienced conflict-related sexual violence, but men are often experiencing this as well. And the reality is that most studies, when people were looking at sexual violence, they weren't even asking men and boys. It just wasn't even part of the survey. So now that's changing. CDC just has released in the past few years a couple of broad-based surveys that have looked at sexual violence against men and women, and we see that the harms are not as divergent as you might expect. So can we use facts like these to challenge gender stereotypes, and can we use a feminist analysis to look at male victimization? And I believe the answer is yes, and that's where some of the new thinking is going. Now, of course, the pushback is around resource scarcity. So compassion is not a finite resource. Like, we can care about everybody. There's room in our hearts to care about these harms when they happen to anyone, but resource scarcity is, as always, where the rubber hits the road, and there is some conflict happening at the UN level over who's getting funding, and is there funding being taken away from women's rights organizations and given to groups that are working on men and boys, and that's where a lot of the work needs to be done, and we need to find solutions that use kind of a gender-inclusive approach, but at the same time are gender-sensitive to the ways in which women's needs and men's needs are still sometimes different. So that is my conclusion. Right on time, can you hear that? I am impressed with myself. Okay. So thank you. And I really look forward to your questions. And I was also instructed by our organizers to insist that you use the microphones. So there's a microphone here and a microphone there. So if you have a question or comment, I would be delighted to hear from you. I see a few people walking toward the microphone.
Hi, thank you for such
Hi.
an interesting talk.
You're welcome.
My question is, what kind of justification does the U.S. use for not signing on to CEDAW?
It's the entire Senate. It's not like the U.S. doesn't really speak with one voice. There is for sure an enormous dose of American exceptionalism when it comes to everything happening at the United Nations, from the Security Council on down. I guess what I could imagine, let's say a Republican opponent of the ratification of CEDAW on the Senate Foreign Relations Committee might say, he or she might say something like, we already respect women's rights. We have women are more equal in the US than almost anywhere in the world. We don't really need the United Nations to tell us what to do. We're not interested, we don't need this, we're not interested in signing it, we're doing just fine. The other treaty that the US has not ratified is the Children's Rights Convention, and our buddies in the non-ratification world are even smaller because it's just the US and Somalia at this point. And that one, for many years, there was a bit more of a concrete legal justification for not signing it, which was that the treaty prohibits the execution of people who committed a crime when they were a minor. And at the time, we still had the death penalty. For many years, and until recently, we had the death penalty even for people who committed a capital murder before turning 18. And so we said we couldn't sign it because it was actually incompatible with our laws. The Supreme Court has overturned that, and it's no longer the case, and we still haven't signed or ratified it. So in general, there isn't a great deal of eagerness on the part of the US to participate in these various treaties. But at the same time, we are actively involved in encouraging states around the world to improve their own human rights records. So we can argue whether or not we need CEDAW as a matter of law to improve women's rights in this country, but we certainly should be better participants. It would improve our ability to advocate, and it would diminish the charges of hypocrisy that are often leveled against the US in the international arena. So it would also seem to be important for that reason.
Hi, I wanted to ask you about your views on the CDC's recent recommendation that women who have the potential to become pregnant shouldn't consume alcohol. Do you think it relates to human rights in any way, or is it more of a social thing? I just wanted to know more about your views on that.
I'm totally pissed off about it, actually. Thank you for asking. I just wanted to throw up. I mean, I just saw even the images, they're so condescending, like these perfect little women, and like how they're just, so for those of you who don't know, the CDC just issued recommendations saying that, fine, we all agree, we don't all agree, but let's just assume we all agree that drinking any amount of alcohol when you're pregnant is bad for the fetus. You can take that off the table. The recommendation on the part of the CDC is that any woman who might become pregnant should refrain from drinking alcohol. And to me, it's this kind of like condescending, nanny state, overreaching, anti-feminist I really had a problem with. I was shocked. I mean, I'm glad it's been made fun of all over the Twitter sphere and elsewhere, because that's just the kind of thing that turns people off of public health messages. It's just, you can't take it seriously when it's so paternalistic. And I just can't imagine in a million years that this type of paternalism would ever be issued against men's behavior. It really paints women as incubators. Like, fundamentally, you're an incubator waiting for pregnancy, and you need to keep it pristine in case this happens. I also don't think it would happen in other countries, and I think it's part of a pattern of not respecting women's reproductive autonomy, and we see the other ways in which abortion is being restricted and so forth. And it also, just to bring it back to global health, is happening at a time when other countries are advising women around the world, particularly in Latin America, to not get pregnant given the Zika virus. Now, of course, these are horrible outcomes for children in terms of birth defects, but a lot of it is the style. So that's what I mean when I saw it, and the image that they released with it was just so, I don't know, condescending, for lack of a better word, toward women, that the pictures of these women, and they're like a non-pregnant woman, and she shouldn't even be drinking, and a pregnant woman, and she certainly shouldn't be drinking. And so fine, the health message is important when it comes to Zika virus, but it's happening in Latin America, where there's not necessarily access to contraception, and there certainly isn't access to abortion, and there are high rates of violence against women. So again, it's like the onus is on women to be the standard bearers, and instead the message around Zika should have been something along the lines of both women and men need to take care and think thoughtfully about their reproductive choices and their sexual behavior. And governments need to create environments whereby women and men can control the timing and spacing of their pregnancy so that they can respond to these various health emergencies. So to put the onus on women in a context where some women can't refuse sex, some women can't access contraception, most women in Latin America can't access abortion. So it was just, so those things happen like right around the same time, and any time I feel optimistic about the progress we've made, then there's something like this where you just go, oh, you're kidding me. I can't believe we're still at this point. So thank you for letting me rant. I'm really glad you asked me that question.
First, thank you. And then second,
Welcome.
my question's fairly broad. So people too often refer to health and healthcare as a privilege, not a human right. So I was just wondering what your perspective on that and how you approach those conversations would be.
Who are those people?
I've heard it way too many times. It's unsettling.
Yeah, I mean, health is a privilege? That's just sad. I don't even know how to respond. I mean, I think it's very American, this idea that health is a fundamental human right is, as I've discussed in the presentation, a well-established right in terms of the global community. It almost exists without question in other parts of the world. People don't think of it as a privilege in any way. And it's so necessary for the realization of so many other rights. Like, how can you be a fully realized person if you don't have the ability to access healthcare and the ability to be healthy? The language is even careful. Like, the language and the instruments in WHO say the highest attainable standard of health. So they're already acknowledging, look, genetics are going to play a role, individual behavior is going to play a role. There are certain things that the state has no control over. But the highest attainable standard of health seems to me a very basic and ultimately realizable goal that we should strive for.
Thank you.
Hi, so in certain situations, such as like the distribution of birth control, for example, in developing countries, there are certain cultural restrictions oftentimes that prevent women from receiving the care they need. And that's a human rights violation in certain ways. But obviously these women need that health care to be able to plan their lives and whatnot. So how would a state, go about constructing a law that would be sensitive to certain cultures as not have that savior mentality where it impedes on a community's culture, but at the same time provide the care that these women need?
Yeah, it's such a great question, and it does get to one of these fundamental dilemmas that has existed in the human rights movement for a long time, right? So how do you get past this? And contraception is a perfect example. It's like a quintessential example, but you can also apply it more broadly to the entire human rights movement. So this notion that there's this like kind of Western savior, this like sometimes people call it helicopter activism. We're going to zoom in our helicopters and parachute down, assess the situation, save everybody, and then leave. Doesn't work that way, and it can backfire, actually. So, I like to think that the human rights movement writ large has moved beyond that. There are counterexamples and there are problems still, but by and large, kind of the state-of-the-art, the standard way of thinking about human rights interventions is to not do anything without local partners and to respond to requests of local partners for help, for partnership, and to work together. So, every human rights organization that I respect only operates in that way. Speaking just for myself, I teach at UCLA Law School, and I had so many American JD students coming to me saying, I want to be a human rights activist, I want to go somewhere in the world and change the laws and policies there. And I don't discourage them, and I understand it, but I often say, look in your own backyard, what can you do close to home? And at the same time, I started a program that was about bringing lawyers from other countries who were already practicing in their home countries, bringing them to UCLA, where we're great at training lawyers on social justice activism. It's one of our real strengths. Giving them the UCLA credential, giving them that degree, and then helping them launch their careers back home. And that's how sustainable change really happens, because then you have kind of a growing cadre of highly trained lawyers who are trying to improve the situation in their home countries. And I think those types of techniques and those perspectives are the only meaningful way to address what you've raised.
Thank you.
One more, or that's the end? Oh, we have to end now. But I will be around. We have a break, I think, so I see there are two of you there. Please come up here and let's talk. And thank you very much for your great questions and your attention.